Hello, everyone. Greetings from Scotland and the UK. My name is DILIP Nathwani, and it's my honor and privilege to do a short introductory message to open the third national ASPICON being held in India. Antimicrobial resistance is a global challenge, and you in India are at the coalface with this challenge. One of the few responses to antimicrobial resistance that we have some control over is improving the quality of human antibiotic prescribing. So therefore, this conference on stewardship is addressing one of the key responses to the pandemic of antimicrobial resistance, which has significantly been impacted by the current pandemic of COVID-19. I am sure you will share and learn and hopefully implement a range of stewardship responses that are bespoke to the Indian context. And hopefully that will achieve the outcomes that we all desire for the patients and the public we look after. I have had over a 35-year period a large experience of learning about stewardship responses from not only my own country and my own experiences, but from engaging and learning and sharing experience with colleagues around the world, including colleagues from India. If I was to have to give you some very short things that I think are really important when you consider a stewardship program, where you're at the beginning, at the middle, or at the end of your stewardship journey, here they are. I think stewardship needs to be context, culture, and geographical specific. The solutions that may occur in my country and elsewhere are not necessarily the solutions that are relevant and important to your country. But if you are going to embark on that stewardship journey, I suggest a few tips. Always prepare and always plan. Invest energy in preparing and planning, and understand what the facilitators and the barriers are in your healthcare facility so you understand what the potential solutions will be. At all times, engage with the hospital leadership, but importantly, with the people that prescribe, and find the champions who are like-minded to help you in your journey in implementing stewardship. Before you execute or implement stewardship, you need to make some priorities. And one of the things I've learned, often to my cost, is when you implement, do it in small incremental stages. Do not try to achieve too much too quickly. Achieve small amounts quickly, and that will grow into a very successful stewardship program. So always prioritize, and at all times support the prescribing community with your knowledge and information. Underpinning all of this is measurement of data. Learn how to collect data that is meaningful and valuable, not only to the stewardship team, not only to the leadership, but also to the prescribers that you're trying to engage. And at all times, buy them in and take them on that journey of measurement and improvement and feedback. Underpinning all of this remains education and training, and this needs to be on a constant basis, from the young doctors and pharmacists to the middle grade ones, and even to our senior clinicians. They need to engage in the learning process. But the challenges you'll find of stewardship programs will also remain around sustainability and resilience. And around the world, that remains a problem. People run out of energy, people run out of resources, and prescribers go back to the default position. Make good prescribing a good habit. Like washing your hands in IPC, make good prescribing a habit for your prescribers. And ultimately, when you achieve success, you share it and spread it to your local community, regional community, and nationally. So these are kind of some very early thoughts on where I feel that your conference will go, and I'm sure you'll find it a very rewarding and ultimately successful experience. I hope one day to be with you, but in the meantime, may I wish you luck and good learning. Goodbye.